Good evening. A Scottish company is facing a criminal investigation after hundreds of tons of medical waste, including human body parts, was allegedly stockpiled rather than disposed of.
Healthcare Environment Services, with bases in Lanarkshire and Dundee, says there is a UK-wide shortage of high-temperature incinerators, which are used to deal with the material. Senior reporter Gordon Cree has been following this story.
At Normanton in Yorkshire, this is one of 5 sites operated by HES in England where the Environment Agency says rules were broken. It's understood that NHS waste, including amputated limbs and pharmaceutical products, were stored securely but not disposed of within the time they should have been. The UK government insists there's no risk to the public, but the local MP wants more answers.
The government's had a top-level COBRA meeting about this, but then provided no information to the local community, to the public or to Parliament. And especially when there are environmental health questions being raised, I think that's just an irresponsible approach. It's unfair on local people, and I think, frankly, the Department of Health should know better. They've got to provide full and transparent answers.
Healthcare Environment Services is based in North Lanarkshire and also has a site in Dundee, as well as the English operations. It didn't respond to our request for an interview, but in a statement pointed to a UK-wide shortage of high-temperature incinerators.
Anatomical waste is not stored on any of our facilities for longer than is allowed by permitted guidelines. All clinical waste is correctly stored. We have not had any notification of legal proceedings against the company.
The company's base just outside Shotts here is described as a storage, processing and incineration facility. It is being monitored by the environmental regulator SEPA, but certainly from the comings and goings here today, it looks like business as usual.
This operator works across both countries and of course has a lot more facilities in England, so we work closely to make sure we've got a coordinated approach and that at our end of the system we ensure that the Scottish facilities are meeting all the environmental standards.
The Scottish Government says HES does provide NHS Scotland with clinical waste disposal services, but that health boards here have not reported any disruption to it. Gordon Cree, STV News.